11 deaths in fact happened at the SVR Ruya Hospital in Tirupati because oxygen was in short supply, and that's because of a delay in the tanker reaching there. I'm now joined by Mr. M T Krishna Babu, who is in fact the Secretary for Transport and Roads and Buildings in Andhra Pradesh, and he's in fact in charge of the oxygen supply and transport issues there. Thank you, Mr. Krishna Babu, for joining us. The very unfortunate incident that happened in Tirupati at a Tirupati hospital. The Chief Minister has now written to the Prime Minister asking for increased allocation. In this particular case, the Chief Minister went on record to say that there was a delay in oxygen actually reaching the Tirupati hospital. What is the situation for oxygen supply in the state? You have also asked for 320 metric tons of extra oxygen to be supplied now.
Yes, actually, we are getting around 590 tons sufficient allocation we are having. Almost 200 odd tons is from a distance of around 1300 to 1500 kilometers from Orissa and Rourkela. So we are getting difficulty in transporting the oxygen up to the allotted quantity also. We are making all the efforts to ensure that more number of tankers are present in service and more efficient management of the fleet is done. Because of the increased payload, when it's almost caseload, March 24th, we were allocated around 480 tons when the caseload is very less. So almost now it has almost more than doubled from March 24th to now. We requested Government of India to allocate around 910 metric tons. We got around 590 metric tons. We are trying our best to see what best can be done in the circumstances, but duly posting, as Honorable CM has also put some very senior IAS officers in charge at these three places where from we are drawing this oxygen, Tamil Nadu, Karnataka and Orissa. So they are positioned there, they are regularly monitoring with the suppliers and also ensuring the logistics, especially the transport is optimized. We are also doing audit of oxygen consumption in the entire, each of the hospital. So definitely with the available oxygen, because it's the Government of India, we are repeatedly requesting to increase the oxygen supply. But of course, overall situation, they could give us 590.
As opposed to a Delhi or a Mumbai, you know, the increase in the COVID cases, the peak of the COVID, according to some projections, will perhaps happen towards the month end. What is the kind of demand that you're estimating your oxygen could go up to? And from last year to now, what is the kind of ramping up that Andhra Pradesh itself has done? And the third point I just want you to comment on is, you know, each state now, even though centrally the allocations are made, Tamil Nadu, for instance, has said that it cannot give out its own oxygen. Kerala has said it cannot give oxygen, its surplus oxygen, because they themselves, their own demand is increasing. So have the states been left to themselves, in a sense, to be able to work out those equations?
Yeah, the empowered group in Government of India is assessing the situation and making allocations. But only thing is, the allocation is not to the expectation and also to meeting the requirements of the local level. We got allocation from three different sources. One source, especially, you know, that Orissa, with a lot of distance, and the peak load we are expecting by month end, maybe first week of June. So at the peak load, almost another 2 weeks, we are expecting this will further increase and active case load will increase. That is the reason why we wrote to Government of India. Honorable Chief Minister has written to Honorable Prime Minister requesting 910 metric tons of oxygen, and also to improve the logistics, but it's transportation. He has also requested 20 ISO containers being imported to be allotted to Andhra Pradesh in view of the serious situation. So unless we get more allocation and also the tankers, what we requested, it will be a challenge for us. We are at it. We are doing our best within the available
Andhra Pradesh
resources.
is already, we understand, flying in tankers from Gannavaram airport into Odisha, so that you can kind of at least reduce the lead time, and you're also importing oxygen through the Navy, through the water route as well. But one other important issue, ambulances between Andhra Pradesh and Telangana, the ambulances that were coming from Andhra Pradesh towards Telangana were being stopped for the last 2 days. Of course, medical infrastructure in Hyderabad is something that many people would want to access. Has that issue been sorted out? Have the two governments been able to talk on this issue?
Yeah, yesterday this has happened. So the local police, especially at the checkpost, they were telling that our instructions from the government of Telangana. So immediately our chief secretary has talked to chief secretary of Telangana. Of course, some time delay is there to resolve the problem. Today, I was briefed that the issue is sorted out, but only thing is Telangana may be feeling that their hospitals are getting crowded and wants to restrict, but we only request because ambulance as per international protocol should not be stopped as a life and death person. So we repeatedly requested Telangana not to resort to these extreme steps because even though everybody is under a tight situation, the bordering districts of Telangana also may access the facilities in Andhra Pradesh or some other Maharashtra or anything. So this should not be resorted to, and we are continuously in dialogue.
Okay, thank you so much, Mr. Krishna Babu, for joining us. So states, in a sense, having to work out equations between themselves and also perhaps having to source their own vaccines, like Andhra Pradesh and Telangana have also not now gone in for global tenders to procure vaccines. How far that will be successful, that of course has to play out, and we have to wait and see. Back to you, Gargi.